everyone. Today we are going to start osteology of upper limb. As we all know, the bones which is present in the upper limb are clavicle, scapula, humerus, radius, ulna, carpals, metacarpals and phalanges. And today we are going to see only the clavicle. Okay. For anatomical position, you should hold the clavicle in the hand horizontally. Then you can see there are two ends. This is the lateral end, this is the medial end. Lateral end should be flat and medial end should be quadrilateral in shape, and laterally concave anteriorly and medially convex anteriorly. Okay, laterally should be concave anteriorly, medially should be convex anteriorly. This is the left side bone. Okay, there are some peculiarity of the clavicle. It is the first bone which ossify in the body. It has no medullary cavity and it has two primary center for ossification, and it is the only bone which ossify in the membranous. Okay, there is a piercing of some nerves, cutaneous nerve, medial, lateral and intermediate nerves. Okay, with this introduction we'll see some features of the clavicle. As you can see, there are the two ends. This is the lateral end and medial end. Lateral end is flat and articulate with the acromion process of the scapula to form a acromoclavicular joint. Okay, medially there is a quadrilateral in shape. It articulate with the sternum to form a sternoclavicular joint. Okay, then medially you can see there are some surfaces. This is the superior surface. This is the superior surface, and this is the inferior surface. Superior surface and inferior surface, anterior surface and posterior surface. Now coming to the laterally have two surfaces, superior surface and inferior surface, and two borders, anterior border and posterior border. Okay, now coming to the attachment. First we'll go with the lateral 1/3. Anterior border, there is the origin of deltoid muscle, and posterior border there is the attachment of trapezius muscle. Okay, anterior border there is the attachment of deltoid muscle, posteriorly there is the attachment of trapezoid. Superiorly is subcutaneous. In the body you can easily palpate it. Then inferior surface you have trapezoid ridge. This is the trapezoid ridge and coracoid process. Okay, trapezoid ridge and coracoid process, there is the attachment of coracoclavicular ligament. Now coming to the medial 2/3, superiorly it is related with the sternocleidomastoid muscle. Anteriorly it is related with the pectoralis major muscle. Posteriorly it is related with the trunk of brachial plexus, subclavian vein and sternothyroid muscle. Okay, and inferiorly you can see subclavian groove for the subclavian muscle. Okay, subclavian groove for the subclavian muscle, and clavipectoral fascia, attachment of clavipectoral fascia. Okay, and medially it articulate with the sternum. Okay, I'll repeat, this is the lateral end, this is the medial end. Superiorly is subcutaneous, and inferiorly you can see on the laterally there is a trapezoid ridge, conocoid process, and there is a subclavian groove. Okay, then coming to the attachment, anteriorly it's related with the pectoral major muscle, posteriorly it's related with the trunk of brachial plexus, and then superiorly it's subcutaneous on the lateral side, on the superiorly subcutaneous on the lateral side, and inferiorly you can see costoclavicular ligament. Okay, thank you.